they're actually going to help clinicians, I think, in their fields to really use their expertise with patients. So what we do, we build an ecosystem for early detection of Alzheimer's disease. So people around 50 years old with cognitive concerns, they come to us and they get a blood test, a cognitive assessment, and access to our board-certified neurologist if required. And this ecosystem is all done from home, both the blood collection and the cognitive assessment. People come then with a profile, basically, with a biomarker profile, cognitive phenotype, and we guide them in the board-certified neurologist conversation to the next step in the healthcare system. That can be with their PCP, but that can also be with a neurologist they might already be seeing. This profile very much helps the next steps for intervention, and we compress timelines this way. So with our ecosystem, within a month from coming to us with your cognitive concern to getting the results, it's about a month. And we've seen now with our first results that people go through the rest of the system, so seeing a neurologist, getting confirmatory testing, and then getting, for instance, treatment within months instead of years. We've tested this in our community events. So we've performed 3 community events now, one in Southside Chicago, rural Michigan, and intercity Michigan. 455 people participated, and 18% of those were p-tau positive and 8% intermediate. Meaning that we've had about 115 people that are now seeing a neurologist. Of the first batch, so our first event was on May 10th, we had 39 people that were p-tau positive, and all of them have already seen a neurologist, and some of them are also on their path to treatment if that's what they chose to do. Monitoring, you can come back to us every year. So say now your biomarker profile with the cognitive assessment shows that everything is okay, you can check in next year and see whether anything has changed. And for treatment response, we get people way earlier, so people are still eligible for treatment. The disease has not progressed as far yet, and we know that the therapies that are now FDA approved are most effective in this early stage of disease. The main advantage of our ecosystem is that we compress timelines. So you really go through all these steps within a month, and then that the profile that you get at the end of our ecosystem expedites the next steps. Because basically these patients now have a flag of already being biomarker confirmed, already being people with some Alzheimer's pathology most likely ongoing, and then going into confirmatory testing and treatment. That's one advantage. The other thing is also that people come in with maybe a certain concern or anxiety, right? People can only get our test when they have memory concerns, and we can either take them by the hand and say, hey, at this point we don't see anything for Alzheimer's, but these are other reasons for cognitive concerns, and please go address them with your PCP or neurologist if you feel that that's the next step for you. So we can really inform people very well. It can also be a relief to actually hear that something is going on towards Alzheimer's disease, because your worries are at least confirmed and you can now take action. The limitations, we are at the end of the day, for the second part of our patient journey, we rely on current standard of care. And there are wait times for neurologists, and there has to be confirmatory testing. Now, what we have seen with our first participants already is that because of that biomarker profile, that timeline also gets expedited, because they see now that these people need the help, need the care. So we really focus a little earlier than memory clinics. So really first signs of cognitive concern, people are very much still in the workforce, taking care of their family, feel that something's off, and we want to support them in the most easy way possible, just doing a test at home and seeing what's going on. Again, with that biomarker profile and the cognitive phenotype that we then establish, and the conversation with a neurologist after that, we guide people into the right place in the healthcare system. But also people that don't need to see a memory clinic will not go there anymore, and we can help them find other pathways that are specifically right for them. Especially when they don't have underlying Alzheimer's disease pathology, we can help them find their next step. I think we could really alleviate, honestly, the pressure on memory clinics this way.